Ischemic stroke is, in fact, one type of stroke. A stroke is a disease in which the brain is damaged due to the blockage or rupture of its blood vessels. When a stroke occurs and the brain is damaged, it may result in the loss of bodily and linguistic functions controlled by the brain, and in some cases may lead to death. Many people may find the term stroke to be complicated, but it is actually classified into two main categories. These are ischemic stroke, where the brain's blood vessels are blocked or clogged, and hemorrhagic stroke, where the blood vessels rupture and bleed. In the past, it was believed that bad air was the cause. But now it is understood that the actual cause is the blockage or rupture of blood vessels in the brain. In this video, we will clearly explain the precursors to ischemic stroke, one type of stroke, through doctor-supervised animation. Hello, we are Medivery University Hospital. Our channel provides information about diseases and medical health according to a Japanese physician. If you are interested, please subscribe to our channel. Ischemic stroke occurs when the arteries that supply nutrients to the brain become blocked, preventing blood flow to the brain cells beyond that point, and leading to the necrosis of those cells. The symptoms and severity of ischemic stroke vary from person to person, but it is characteristic of this disease to have no symptoms usually, then suddenly manifest them one day. Furthermore, the most important thing to minimize the sequelae of ischemic stroke is to start treatment at a specialized hospital as soon as possible after its onset. Symptoms of ischemic stroke. Ischemic stroke often occurs without any prior warning. Symptoms that may indicate ischemic stroke include sudden difficulty moving arms and legs, sudden numbness in one side of the face or limbs, sudden difficulty speaking or finding words, sudden blindness in one eye, sudden dizziness and loss of balance. These symptoms are also common in hemorrhagic stroke. But in the case of hemorrhagic stroke, the spreading of blood within the brain often increases intracranial pressure, leading to headaches and consciousness disorders. Thus, the symptoms of ischemic stroke vary, but a major point in identifying brain symptoms includes sudden onset of symptoms, paralysis or numbness appearing on one side of the body affecting either the right hand and foot or the left hand and foot, symptoms appearing on both sides, like in both hands or feet, often indicate causes other than the brain. Presence of above-the-neck symptoms such as speech disorders. These signs are important, and if present, ischemic stroke is suspected. What are the characteristics of precursors to an ischemic stroke? Sometimes, symptoms of a precursor may appear before the actual onset. And if these precursor symptoms are treated at a hospital, it is possible to prevent a full-blown ischemic stroke. Characteristics of precursor symptoms include symptoms disappear within minutes, hours, or up to one day. Symptoms are brief but recur. These are often considered precursors to ischemic stroke, known as transient ischemic attack, or TIA. The disappearance of precursor symptoms within a few minutes, several hours, or up to one day is because the blocked blood vessel quickly reopens, leading to rapid improvement and resolution of the precursor phase. However, it is unpredictable when the same issue might occur again, leading to a blockage. Therefore, it is necessary to seek prompt medical attention at a specialized hospital. Particularly when symptoms disappear quickly, caution is needed. There have been many instances where individuals did not seek medical attention because they thought it was nothing serious, only to suffer from a severe ischemic stroke later. Seek immediate hospital care, even if brain symptoms resolve quickly. To prevent a major ischemic stroke, seek hospital care immediately if only precursor symptoms are present. The main medical departments handling strokes are neurosurgery and neurology. Hospital diagnosis and treatment. If ischemic stroke is suspected, necessary examinations will follow a medical consultation. CT scan takes sectional images of the brain using radiation. It can be performed quickly and also distinguishes between ischemic stroke and hemorrhagic stroke. MRI scan takes sectional images of the brain using magnetic forces. It can diagnose ischemic strokes that are too recent to be detected by a CT scan and also identify which brain arteries are blocked. Angiography. By injecting a contrast agent into the arteries through a catheter and taking X-rays, even the fine blood vessels of the brain that cannot be captured by MRI can be examined. At specialized hospitals, such examinations are conducted to evaluate and diagnose ischemic strokes and poor blood flow. If an ischemic stroke is occurring or likely to occur, treatments include oral medication. Drugs like aspirin are used to prevent blood vessel blockage. Intravenous therapy. If an ischemic stroke has occurred, intravenous treatment is used to improve blood flow to the brain and prevent the expansion of the infarction. TPA, tissue plasminogen activator. Recently, a highly effective intravenous drug for ischemic stroke TPA has become available, but it can only be used within 4.5 hours of symptom onset. There is also a risk of serious side effects like hemorrhagic stroke, so its use is at the discretion of specialized physicians. Surgical and catheter treatment. Surgery, catheterization, or balloon treatment may be needed to open blocked vessels or enhance blood flow to the brain. Rehabilitation. Along with these treatments, rehabilitation is conducted for symptoms like paralysis and speech disorders. Early hospital visit for early treatment. Early hospital visit and treatment initiation are crucial for treating ischemic stroke. The highly effective TPA treatment in particular can only be used within 4.5 hours of symptom onset. Every second counts in diagnosing and affecting the course of an ischemic stroke. Sequelae of ischemic stroke can include various symptoms such as motor paralysis, speech disorders, and memory impairments. The later the discovery, the more severe the sequelae can become, potentially leading to death in the worst case. If you suspect an ischemic stroke, regardless of how mild the symptoms are, do not delay and seek hospital care as soon as possible. How was the video? We want to know what you would like to see made into a video. If you have any health questions or unexplained symptoms that you're concerned about, please let us know in the comments section. If you found this video informative and interesting, please like and subscribe to encourage us in our future activities. Thank you for watching.